Namaste all the viewers and friends. I'm sure you're all watching our videos. We must thank you for encouraging us with your views. Please drop in your comments, your queries, your suggestions for topics that you want us to cover. We'll be very glad to take up those topics and discuss on those topics as well. Today we have come up with a topic, a very important and something that needs to be discussed also. Cancer and its management. Okay, a lot of people definitely have awareness about what cancer is and how it develops, all that. There's a little bit of awareness that needs to be put forward to understand what therapies can be used, what alternate therapies can be used to support the cancer treatment outcomes and improve the quality of life. First, let us understand what cancer is. Cancer is a proliferative, which means there is unregulated growth of the cells and abnormal cells. These cells are not normal cells that are growing, but are abnormal, and the regulated growth of the cell or the death of the cell doesn't happen. That growth and death cycle of the cell is hampered, so it is unregulated and abnormal cells that are growing. And there is also inflammation that is happening. What promotes the inflammation or what promotes this unregulated growth of the cells is the first thing that we need to understand. If you understand that, we are halfway through in either prevention or in management. Most of the times I want to give a little time for this discussion. So maybe we will have 2 videos to discuss on this topic. When we talk about management, many a times we always think that if I have a disease, then I will think about how I manage it. Management, the first thing that comes in management is prevention. So if we understand the causes, we can prevent it. That's the first step in management. The second is how do you treat it, how do you rehabilitate it, how do you work on the secondary and tertiary preventions. What are the causes? Genetic causes, genetic predisposition, 2 important things. And genetic predisposition is promoted by a lot of other causes that can lead to development of cancer. Doesn't mean that there is a familial cancer that is running in the family. Everybody in the family gets cancer. So all of them in the family are predisposed. Who develops cancer, who does not develop cancer depends on mainly the lifestyle factors. What sort of food habits we have, what sort of physical activity we have. So some of the causes are smoking, active and passive smoking, alcohol consumption, taking red meat, intake of red meat. Obesity is one of the major causes. There are a lot of studies that are indicated that diabetics also are prone to develop cancer because of increased glucose levels and insulin resistance mainly that are seen in diabetes mellitus. Next, what other factors promote these inflammatory changes in the body? Lot of pollution, environmental pollution, indoor pollution, pollution caused, like I told you, because of the smoking, internal pollution, right? So pollution is one of the major factor. Stress is also one of the factor that causes cancer and also promotes spread of cancer. Lot of times cancer can be treated and taken care of, but if it is accompanied with a lot of stress, it will spread and that becomes difficult to control and manage. So these are some of the major causes of development of cancer. So there is genetic causes, lifestyle causes, causes because of the pollution and stress. These are the causes that we understand. And cancer, just because these are the causes, doesn't mean that I'm exposed to it and I am exposed today and I get cancer tomorrow. Cancer doesn't develop overnight. It is low-grade inflammation that is happening slowly, gradually, which is not taken care of and can develop into a cancer on a later stage. So we'll have to understand and recognize the low-grade inflammation, start preventing it right there so that we don't end up with complications like cancer. Cancer is one of the complications of low-grade inflammation. So we have now understood what are the causative factors. Now let us understand how one receives the diagnosis of cancer. When cancer is diagnosed, when somebody says you're diagnosed with cancer, the first thing that a patient or a client goes through is denial. How can I get cancer? Next stage is anxiety, fear of losing life, fear of lot of things that they were losing a lot of things that they were doing. For example, if I'm a person who will travel, I cannot travel anymore because I have cancer. So there's again a kind of sadness and fear of not being happy, fear of not enjoying life. Financial burden is also one of the important things. And many a times the anxiety of cancer, because it is portrayed as a death sentence, itself can aggravate the inflammation to much great extent. So that is the first thing that a lot of times they go through, and eventually they either continue with denial or they kind of come to terms with it, accept what needs to be done. So now we have understood how diagnosis can itself, or the phase of how one goes through diagnosis can itself contribute to aggravating the symptoms. Majorly what happens with cancer is that the quality of life, the physical health, the psychological health and the spiritual health, all is at stake, right? So the quality of life is going down. So we have to understand how we can improve the quality of life. First thing is to take proper treatments that are very, very important. Usually it is surgery, it is chemotherapy, it is radiotherapy, it is targeted therapies, hormonal therapies, depending on what type or kind of site of cancer that you're going through. It'll decide on the treatment protocols that needs to be taken care. So please visit your oncologist, understand the treatment options. Many a times is denial to go to an oncologist. Why should I go to an oncologist? They'll give me chemotherapy, my hair will go. There's a lot of anxiety with the treatment itself, but cancer treatments are necessary. So please visit your oncologist, understand what therapies or what treatments are necessary for your cancer care. That is the first thing. In the next video, we will understand, along with conventional mainstream cancer care treatments, what other therapies will help you improve your quality of life. One thing. Second thing, increase the outcome of cancer treatments that you're going through, that you're taking, and also relieve you of physical distress, psychological distress and spiritual distress. So with that, I end this video, and in the next video we will discuss about our therapies and supportive therapies that are there to improve the quality of life. Thank you very much.